Hello everyone. Welcome to the Edelweiss channel in Asia. And right now, we will be discussing how you can have a single appointment and have a greater smile that really looks natural. And I am very proud to say that we have a very special guest coming from Indonesia. So, to make it quicker and we can discuss as soon as possible the case, let me introduce to you one of the most respected dentists here in Indonesia, Dr. Eko Priambodo. Dr. Eko, tell something about yourself.
Well, hello, Dr. Jin. Thank you so much for having me here with you and your channel. It is a great channel. I watched some of your channel actually.
Thank you.
But anyway, I'm Eko. I'm 53 years old right now. I'm doing a dentistry for many years, and now I'm specializing myself in cosmetic dentistry. So, what do you want me to talk about, Dr. Jin?
Yes, so we will be discussing, Dr. Eko, your case, and you will show to everyone that it is possible to have a natural smile, the one that doesn't look artificial, and you can do it in one appointment. See, and this is very interesting because right now, although the COVID is going down, but still it exists. So you don't want to keep on going back and forth to your dentist. And also, Dr. Eko, I think Manila and Indonesia is the same when it comes to traffic.
Yeah.
It takes too long to go to one place to another.
Right.
So this will save you time. And plus, it is not that expensive, right?
It is not that expensive. Definitely, doctor. It is not that expensive.
Okay, so let's start with your case. Basically, can you tell us something about what is the problem of this patient?
Oh, well, yeah. This patient is Mrs. Poppy. She's 50 years old and she's having problem with the crowding anterior.
Okay.
In the front of her teeth.
Okay.
She want to look it first. She want to look brighter and whiter. Because as you can see from the frame, it looks a bit darker and grayish, right?
Yeah.
And also to have that smile, actually you need an orthodontic treatment.
Yes.
Right?
Yes, because basically, Dr. Eko, isn't it before all, we are so happy that we are in the era of technology. And there's so many developments already, including in dentistry.
Right.
And majority, as I look also with the picture, is that the patient generally before you, in order to fix that, to have a straight smile, you need to wear braces or you will have crowns in your teeth, and crowns will damage majority of your tooth structure, and braces is also expensive. Although braces is good, don't take us wrong. Okay, of course the ideal treatment is orthodontic braces, but if you cannot afford it or you don't want to have it in your teeth because it is quite inconvenient, right?
It is quite inconvenient. That's
Yeah.
a good word, because she's mature mom and a professional. She didn't want any strange thing in
Yes.
in
her
their mouth,
yeah.
in her mouth.
Because
right?
it's kind of awkward, Dr.
Yeah.
Eko, to have metal brackets or stuff. I mean, there are also braces now that is like, it's called Invisalign, right? Or clear aligners. But there are certain cases that still cannot be straightened out by these aligners. So
time.
yeah, so it's really a hassle, especially if you're a mother, right? Okay, Dr. Eko, run us through what the patient needs to do before to have the treatment, and then tell us how you do the treatment.
Thank you, doctor.
Number one.
Number one, when she came to my office, we do some prophylaxis. Of course,
Okay, yes.
we must,
Yes.
because we need to get rid all of the food debris, the
Yes.
oil, and everything. And then
The second
is we capture her smile.
yes,
we-
diagnosis.
We diagnose it.
Yes.
Either you using the panoramic X-ray
Okay.
or and take a intraoral picture.
Okay.
You take a picture to document it in
Yes.
clinical way.
Okay.
And
Third is the treatment.
the
already.
treatment is the
Okay.
treatment
So
already.
before you go to the treatment, Dr. Eko, because the treatment of choice is veneer, right?
Right.
Yeah. Tell everybody, what is veneer?
Oh, okay. Veneer is some what I call a laminate is some what you call it in English, doctor?
Yes, it's like a facing.
A facing.
Just
like
the
stay
front teeth.
in the front teeth only.
Yeah, you place it
Mhm.
only in the front
In the
area,
front area.
of the
Like a
tooth
fingernail,
extractor.
something.
Yes, like similar, correct?
Similar, right?
Yeah, you know the artificial nail.
Nail.
Yeah,
Yeah.
it's the same.
It's the
Okay. So now you are going to do the veneer. Basically, before you need to have the lab to do the veneer, right? But this one
this woman
you don't need to.
time.
Okay, don't have
We
time.
really don't have time.
Yeah, and what is nice about this, Dr. Eko, is you do not have to place, do the impression and things like that, right? Because in the lab, it is required to do an impression. Okay, so what is the first thing you do in the treatment?
Number one is I'm doing of course, cleaning it out.
Yeah,
And then I'm doing a try-in.
Okay.
Since the veneer is only a 0.5 thickness.
Okay.
So I need to do the try-in. I call
Yes.
the procedure try-in.
yes, or mock-up.
Mock-up,
Yes,
mock-up. It only took me for about around 10 minutes lah
Okay,
to see how the mock-up will looks like.
Yeah. Okay, so for those who doesn't understand, the
Mhm.
mock-up is like they will place, temporarily the veneers because this is pre-made, right?
Right,
Dr.
right,
Eko?
right.
They will place it temporarily to see
Mhm.
if the patient likes it and if everything is okay. So it is like buying
Yeah, you do the
clothes.
fitting it.
Yes,
Right.
so you do fittings, right?
Right.
So that's the first one. Then the second,
Then the second, I prep the tooth minimally,
okay,
just only to have the roughing it
yeah, for
just
retention.
for retention. It only took you only 0.3 or something, just
Yes,
roughing it.
Yes.
So we can gain a micromechanical
Retention,
bonding retention
yes,
with the
yes.
tooth from the veneer to the tooth.
Yes. And also, Dr. Eko, if there is caries, right, you remove
Oh,
it. Yes.
yeah.
Yes. Well, does she? I think she has caries on the.
Yeah.
The
You can see
central
from the
incisor,
picture that
yes.
she had a
So you have to
cavity.
remove that as well.
We
right?
need to remove it and
Uh-huh.
do not worry because we just fill it
Fill it with composite.
with the composite.
Yeah. Yeah.
And what the important thing is, this is a very minimal invasive.
Yes. Now, for you to understand what minimal invasive for us
Yeah.
is that because before dentist needs to remove a lot
Yeah.
of the tooth structure in order to restore it, and nothing can replace natural tooth.
The natural.
So the less we remove, the better it is, so that if there is a problem in the future, there is still room for the dentist to fix it.
Yeah.
Yes, because before, if there is a problem with the tooth and then you reduce it a lot, the tendency, if there is a side effect, what happens is it goes to the root canal already. Okay,
Yeah,
so
we don't want that.
yeah, we don't want that. So after the tooth preparation, the second, Dr.
After
Eko,
the tooth preparation, doctor, thank you. After
So-
having the good mock-up, and
Yes.
now I know I can figure out how the veneer will look
Yeah.
like
yes,
and how the smile will look like. And then I discuss with the patient what kind of white her white is.
okay. So
Uh,
the shade,
The shade, we call it the
Yes,
color
yeah,
of the
yes.
veneer and going to be
Yeah.
the smile.
okay,
We don't want we agree not to choose a very bright white, big, bulky thing.
like the color
Like
of the
the
cup
color
here.
of the cup here, right? But that's how lay people perceive it. If you want the
Yes.
white, so you
Yes.
must choose the the toilet wipe,
Yeah.
the bulky
Honestly,
wall.
listen to us. Okay. You do not want like to look like a horse.
I'm sorry, my words.
Yes. No, no. It really,
Yeah,
I
the
mean,
porcelain.
imagine if this is the color of your tooth and it is on your mouth. When you smile, the tooth is ahead of your face. So
Yes.
we call it
Yeah.
like a horse smile. And you
Yeah.
think it looks good, but it doesn't.
It doesn't, because people will perceive you from many ways.
Even you're afar,
Even,
they
yeah.
can already see your teeth.
Yeah, your teeth, not you.
Yes. And you know, we really advise. But if you like it this white,
Yeah.
we do not have a choice.
Yeah.
We have to give it to you. But you have, for me, Dr. Eko, they
Yeah,
have to
maybe.
sign.
The informed consent.
Yeah, they have to sign, because if they end up not liking it and they want it replaced, then they need to pay again.
Yeah,
right?
because there's a story from one of my patients
Okay.
who chose a very bright white, and she came to the what we call a discotheque dance floor with
yeah, in a disco, in a bar.
discotheque.
Yeah. And then the lights
Yeah.
there will show if you are wearing something.
Right,
fake.
and it end up like she's the only person in that room, and that's
With
true
the-
story with her,
Yes,
because
yes.
people can always notice when she smiles.
Yeah,
And what happened is she always closed her mouth,
Mouth, yeah.
during all the dance,
yeah.
and her boyfriend feels so. What happened with you? Why you not smiling? Why you don't feel happy with me? It's awful.
Yeah.
No, it's not wrong. It's just
Yeah.
cosmetic choices.
Yes, yes. Because, you know, you will know an artificial teeth when you go to this violet or bluish lights that you normally see in the bar or when you're dancing. And then if it is a fake teeth, when you smile, it actually brightens out.
Yeah,
And then the natural, you actually cannot see.
yeah.
So imagine if your teeth is as white as
This porcelain cup,
yes,
right?
the fake one, then you're the only one that they can see the teeth.
Yeah.
And,
From your teeth,
yeah.
they just can easily find you
Yes.
because your teeth.
Yes. And that is also the advantage of this veneer, right,
Yeah,
Dr.
oh, yeah.
Eko? Because it is translucent, so it will really look natural even in those kind of lights, right?
Yeah, this material it made from a barium glass. It's
Yes.
not all 100% porcelain.
Yes, it's not ceramic.
So when the light,
Yeah.
the light can come go through the layer.
tooth, yeah. So it opalesce instead of, you know, like...
Bounce back.
Yeah.
Right.
So anyway, so first you do the mechanical retention, which
Yeah.
is the tooth preparation.
Tooth preparation.
After the mock-up.
After
And
the
then
mock-up.
the second is
And,
you have to prepare the
I prepare
veneer.
the veneer.
Yes.
Just rubbing up the intaglio or the inner surface of the veneer,
Yes.
and then put the what you call
The
it, the
etchant.
composite.
No,
the veneer bond.
you can, yes.
Yeah.
But you can also
the
etch it
primer.
just for cleaning.
To cleaning.
And then there is a special bonding
Special
agent.
bonding.
When
the veneer
dentist,
bond.
yes,
The veneer
when the
bond.
dentist buys this system, the system is edelweiss system, so you need to use the veneer bond on the veneer.
On the veneer.
Yes, the back for mechanical retention.
Yes.
You also need to roughen it up, right, Dr. Eko?
Yeah, just a little bit.
Yes,
Just a little bit. Just to rubbing.
yeah, so that it will really, when you paste it on the tooth,
So
it will really stay
it
put.
will stay put.
Okay.
Yeah, exactly.
Okay.
And then we curing it using the
Yes, cure
special
the
light.
Yes. And then after that,
And then after that,
Roll the
we took the composite, rolling it,
yeah.
and then press it firmly.
Yeah, you place it now
Place it,
on the
then
tooth.
push it in the
Yeah,
tooth, and remove the excess.
Yes,
And curing it using the special light.
yeah,
What we call the special light is
Light
the
cure.
light curing that all the
A
dentists
dentist
having.
use, yes,
has.
yes.
And then voila.
Yeah, yeah. And then you polish it.
That's all. Yeah. If I need,
Yeah.
because I don't really need to polish it, Dr. Jane.
Yes.
Because actually the veneer has it glows, beautiful glows.
Yeah,
Yeah, I polish it a little bit here and there, but
yeah. Just to remove the
just to remove the excess,
And
right?
then sometimes, when you bite, if there is a contact,
That's
then you have to remove that
remove contact, reduce
because
the contact.
you also don't want to fracture it, right?
Exactly.
Yes.
Okay. You
And-
must understand the occlusion first. You
Yes.
cannot just put the
Correct.
veneer.
Yes. The occlusion is the bite of the
bite
patient.
of the patient.
Yes. And also, we need, Dr. Eko and I need to educate you that as a dentist, our role is to conserve the tooth.
Exactly.
You go to us because you want to preserve your natural tooth. Now,
Body organ.
Yes, yes.
You must understand your tooth is your body organ.
Yes,
God gives you the body organ.
Yes, but the problem is, of course, every time you go to the dentist, there is a cost. And majority of you like the restoration to last forever. It's like it has to die with you.
Yeah.
And that is not possible, whatever the material is. However, what I would like to say is that you would prefer that the restoration fractures rather than the natural tooth.
Yeah, good saying.
Yes, and currently, Dr. Eko, right, majority of the materials is the one that doesn't fracture yet damages the tooth if there is a problem.
Yeah.
And this material is different.
Different matter.
It absorbs the force and it's the one that fractures, which a lot of you will think, oh, that's a bad material because it fractures. No, it is actually protecting the natural tooth.
Exactly.
And if money is the problem, you can still earn it. Okay? But the natural tooth, the moment we remove it, that's it. We cannot replace it back.
We cannot. Forever. That's forever.
Yes. And maybe, Dr. Eko, you can also give some advice to them why this is ideal for a lot of people, especially if they just want to have a natural, nice smile.
Well, edelweiss designed to mimicking the enamel layer with it has the 0.2 cervical thickness in the cervical area and 0.6, 0.5 on the body area, and then 1.3 millimeters on the incisal area, just like the enamel layer. Natural enamel layer mostly, generally. And then even if you want your composite set looks, the value you want to look more brighter, you can always reduce from the inside of the veneer, making the thickness, reduce the thickness of the veneer, right?
Because it is adjusted by the cement.
Because it is adjusted by the cement.
Yes.
And the good thing with the dentist is if you don't have time or maybe you should perbaiki, refinement my words here. Problem with the preparation of the tooth. The composite can always feel it, the lack of the preparation. And most of the time, we don't need an anesthesia. Because you don't do it. We don't do it. Which is good for you if you're the patient. You don't need to... you don't have to see the needle. Unless we can hide it. You don't have to feel the numbness and something.
Because we don't reduce the
We don't reduce the tooth.
It is possible.
We just touch it. Another word.
And then what is good about this is, as a mother, for your patient, the after is that it looks very natural.
She loves it.
Yes, because as you can see on the after photo, there's still some, discrepancy in the smile. But that is how natural it is. You don't want really the fake ones. I mean, of course, again, this can be fixed if you want to. But me personally, as a dentist, and we are also patients, right? I would prefer to have a natural looking teeth. I have edelweiss in my lower, and it doesn't look as perfect because I want it to look very natural.
And preserve the more tissues, the more tooth structure.
Yes, and this is a lot cheaper, right? In zirconium, there's other materials that are more expensive than this one.
When as a patient, you need to understand that if if you asking for a ceramic restoration,
Yeah.
so your dentist will need to, it will cost the dentist of the ceramic, the
Yeah.
overhead, the
Yeah.
impression,
Yeah.
all that hassle of the procedure,
Yeah.
and the
Yeah.
dentist also need you to be patient for about 2 weeks
Yes.
to wait, and there's 2 weeks more
Yeah.
in the lab
Yeah. In
for
the
produce the laboratory
Yes.
to produce the ceramic.
Yeah. So you do great work, Dr. Eko.
Oh, thank you.
And don't forget to like, give us a thumbs up and, subscribe in our channel. And also, I will place Dr. Eko's clinic and contact number on the description below if you would like to visit him in
Fly over to
Indonesia.
Indonesia.
Yes. No, even from the Indonesian people. Yeah. So
Don't go to Philippines, just go to my clinic.
yes. Okay, I will say go to his clinic. Okay, so the description below. And please do comment. If you have any questions, just post it below. And definitely, I will try to answer it. And if you have other questions for Dr. Eko will be, happy to answer your questions in the comment section. Okay. So, Dr. Eko, thank you so much.
Thank you so much. It's fortunate for me.
Yes. Okay. Bye-bye.